We understand that the prospect of getting dentures can be daunting, but you have nothing to worry about. Millions of people live their lives to the fullest whilst wearing dentures. Your new dentures will soon have you feeling like you again, but getting used to them can take a little time, and this is completely normal. With a bit of know-how, you'll soon not only accept this new chapter, but be ready to embrace it. Here are our tips on how to take care of your gums and hygiene while wearing dentures. Dentures offer a lot of benefits to people who have lost their natural teeth. They can help them the ability to speak more clearly, smile confidently, and to eat variety of foods. However, there are some downsides to wearing dentures. One problem is that they put pressure on the gums and consequently the bony ridges beneath them. This can cause resorption. It's a process that is the result of gradual decrease in bone volume and density. Bone loss and resorption are accelerated if the prosthetic dentures are worn 24 hours a day. With the decrease in bone volume comes inadequate support for the dentures, causing them to loose and fall out more easily. This also results in less support for the lips and cheeks, which can cause a very huge change in facial appearance. It has been found that those wearing dentures during the night while sleeping are more likely to have denture and tongue plaque, gum inflammation, presence of Candida albicans, thrush, and oral yeast infection, and higher blood levels of interleukin-6, a protein made by white blood cells that signifies the body is fighting an infection. Good oral hygiene among denture wearers is very important and reduces the risk of serious health problems. If they are not properly cared for, the bottom surfaces of dentures in particular can become breeding grounds for oral bacteria and fungi, which can cause odors, irritation and disease. Recent study involving 500+ randomly selected elderly nursing home residents found that the seniors who wore their dentures to sleep were 2.3 times more likely to die or be hospitalized from pneumonia as those who took their dentures out. In addition, if dentures are worn continually, and especially at night when salivary flow naturally diminishes, denture stomatitis can occur. This affects tissues under dentures. Typically it occurs under upper full dentures that cover the palate, which becomes reddened, infected with yeast and becomes inflamed. This is often accompanied by a disease called angular cheilitis, a cracking at the corners of the mouth. Denture stomatitis is treated by removing the dentures out at night, and cleaning them meticulously. Yeast infection is treated by anti-yeast or antifungal medication or chlorhexidine prescription rinses that can be prescribed by your dentist. Whether you wear full or partial dentures, removing them while sleeping is important to give the gums and other denture-bearing tissues a chance to rest, recover and receive beneficial exposure to the antibacterial agents naturally present in saliva. It is recommended that removing your dentures for at least 5 to 6 hours per day is the healthiest thing to do. Here are some guidelines to maintain good oral hygiene while using dentures. Number 1. Remove and clean your dentures after eating. Clean them by brushing at least twice a day with a soft toothbrush or denture brush and toothpaste. You can use effervescent denture cleaning tablet also for cleaning the denture. Caring for your dentures is part of maintaining good oral health. Some Filipinos clean their dentures with toothpaste or plain water, but this may not be as effective as using a soaking solution. Polydent Cleanser kills 10x more bacteria than regular toothpaste *, so you can keep your smile fresh and confident. Number 2. Place or store your denture in water or an alkaline-based solution made for this purpose. Number 3. You need to brush your tongue, inner part of the cheeks and gums with an extra soft toothbrush and not the one you use for cleaning your dentures. Then rinse them before putting them back in your mouth. Please the like button, share the video and subscribe. For your questions, comments and suggestions, please write them down below. See you till our next video. Thanks for watching.